Talking of poor leg circulation, do me a favor right now. Sit back, stretch your legs out, and just look at your feet. In the next 30 seconds, I'm going to show you a test that tells you whether your blood flow is actually reaching those feet properly. You can do it right here, right now, no equipment, no doctor, nothing. And then I'm going to give you 3 fixes that can actually turn this around if you're consistent. I'm a vascular surgeon. I see what damaged leg circulation looks like at the end stage. And trust me, you don't want to get there. So chaliye, let's find out where you stand today. Now here's a truth which most people haven't heard. Your legs are the farthest point from your heart, which makes them the first very place where blood circulation starts slowing, and that is where it will be detected. And in today's world, we sit for long hours, we hardly do any exercise, and sometimes 6, 7, 8, 10 hours really without moving. And every hour you sit without getting up, blood starts pooling silently, without pain, without any drama. And here's the part that makes this really tricky. It doesn't happen overnight. It builds slowly over months and years, and your body gradually adjusts to it. So you do not notice anything. You think it's just normal tiredness, but it isn't. Heavy legs at the end of the day, feel that the feet become colder than the rest of your body, cramp in your calf when you walk, that disappears the moment you rest. ये सब coincidence नहीं है. These are messages and most people just scroll past them. Today, we stop ignoring them. Now here, I want you to go slow and watch this in detail, because the next part is where you need to do it. Not just watch how we are doing it, you need to do it yourself. So here's the 30-second home blood circulation test. It's the same principle we use clinically to assess blood flow in the lower limbs. So sit comfortably, extend one leg in front of you. Now slowly raise it just above the level of your hip and hold it there for 20 to 30 seconds. While you're holding it, don't overthink anything. Just look at your foot. What color does your foot look right now? If your circulation is healthy, nothing much changes. Your foot stays its normal color. Your body is managing the blood flow efficiently. That's a good sign. But if your foot starts looking pale, slightly white, a bit washed out, that is your body reacting to the fact that blood isn't flowing as smoothly as it should. Now, slowly bring your leg back down and watch. Does the color return normally and quickly? That is what we want to see. Does it take a little longer, or does it look slightly blue or uneven before it normalizes? That is the part to pay attention to. It's a signal, and when we understand it, it gives us the chance to act early. Remember what you just saw, because everything I tell you from here is based on this result. Now I want to tell you about a patient, 52-year-old software engineer here in India. Healthy on paper, blood tests are a normal thing. His annual health checkup was fine. And he came to me for something which was very different. And when I ran this exact test, same pale foot, slow color return, he was diagnosed to have early peripheral arterial disease. Completely manageable at this stage because we caught it in time. He told me afterwards, "Doctor, I thought that my feet were always cold. I never imagined it could be this." And another thing he noticed is that when he started walking, his legs started paining at 500 meters. But because he was not walking regularly, this symptom was never detected in time. And because of this test, we could detect it in time and help him on the right medications and lifestyle changes. Now, you must understand why this happens. Your calf muscles, the big muscles at the back of your lower leg, they do something remarkable. When they contract, they squeeze the veins around them and literally push the blood upward. In vascular medicine, we call this as the second heart. It's called as the second heart because this heart also needs help of the second heart. Now, when you're sitting for hours, that pump is completely switched off. It's completely idle. Blood has nowhere to go. It starts pooling in your lower leg. And that is what causes heaviness and cramps in the leg. Along with this, diabetes, which can affect so many millions of Indians, will also damage your blood vessels. Other factors, including sedentary lifestyle, can also lead to blockages in your leg arteries. And when there is a combination of all these factors, then leg artery blockages will lead to pain. But pain only initially happens when you walk for a certain distance. But if you're not walking regularly, this will never be detected unless it goes to an end stage, which would be an ulcer, a wound, or even gangrene. Now the 3 tests which I am about to share, they are so simple that your first reaction would be like, "Doctor, we already know this. you're not telling anything different. But here's the difference between knowing and doing. And this is what makes the difference. Because the way I explain this, it will completely change how you think about them. The first is walk. I know you've heard this 100 times, but let me tell you something that most people don't know. When you walk, every single step should activate your calf muscle pump. Every step literally pushes blood flow up towards your heart. It's not just exercise, it's a physical and mechanical system that your legs desperately needs. Studies have shown that regular walking can improve circulation symptoms by up to 50%. But that only happens when it is done consistently and with the right kind of steps. We have a few videos on walking also. You can have a look at these videos. And many people ask me that I do walking every day, but I'm not getting any result. The difference would be in the kind of walking. If it's a leisurely walking without activating your calf muscles, that may not give you any benefit. But if you do brisk walking for 20 to 30 minutes, 5 days a week with activation of your calf muscle, that will benefit you much more than the leisurely walk you take after your meals with your friends or while going to the shop. So the type of walking is very, very important, and you should always focus on that. Now, fix number 2 is where you have to break the setting. In my clinical experience, this is the single most impactful change most people watching this video can make, because most of us sit far too long without realizing it. And here's a rule that I give to every single patient I see. Every 45 minutes, get up. Even for 60 to 90 seconds, go drink water, walk to the window, stretch your calf, do something that allows your blood circulation to start improving on its own. You can set an alarm on your phone. It takes 5 seconds to set an alarm. But if you do this regularly over the entire day, that will change the trajectory of your vascular health. And fix number 3 is to control your internal numbers, your blood sugar, your blood pressure, your cholesterol. These 3 are working inside your blood vessels right now. And if they're out of range, they can be silently narrowing and damaging those vessels regardless of how much you walk. People with uncontrolled diabetes are 4 times more likely to develop serious leg circulation problems. High cholesterol or any of the cholesterol variants, we have a few tests also in other videos. It can silently build up inside your arteries until one day the arteries become too narrow or almost 100% blocked. But now here's the key thing. All these 3 fixes work best together. Walking alone is powerful. Less sitting adds to it, and controlled internal numbers protect the whole system. Together, you are not just improving circulation, you are protecting your vascular health for the next 20 years. And if you have reached this far, you may want to attend my webinar where I explain in 1 hour how you can improve your leg circulation by simple day-to-day steps. If you want to attend our webinar, do click the link that we've put in our description. But now the last part of this video is where you must know specific signs that tell you that circulation has moved beyond the early stage. And when you notice this, do not wait. Do not self-treat. See a vascular surgeon. Sign number 1 is that you walk for a certain distance and your leg cramps and you have to rest. This is a classic textbook sign of arterial circulation problem called as intermittent claudication. Sign number 2 is when your foot is consistently cold, even in summer, even with your socks on, and maybe there's some amount of pain happening. This can be a sign of peripheral arterial disease. Sign number 3 is any wound or cut on your foot or leg that is not healing the way it should. This is a serious red flag. It tells us that blood flow is insufficient to support the healing process. Sign number 4 is if you have diabetes or you smoke, your risk is already elevated. You should get a formal evaluation done by a doctor. And do check out this video in which I have shared the signs and tests of blocked leg arteries.